morning, I'm Juni. I'm a doctor of medicine. Welcome back to my channel. So today's video we'll be talking about vitamin C and coronavirus lockdown. Right now, we are a lockdown in the Philippines. And if you are not wearing one of these Darth Vader masks, you'll be arrested and fined. If you're not wearing one of these surgical masks, you may also be arrested and fined. So, my main purpose is to look which is more important. Surgical mask, face shield, hand washing, alcohol spray to stop COVID-19. So, as I explained before, there are two factors in an infection. One is the patient or the person. If the person is not immune and somebody else comes around and gives him some virus, he gets sick, and sometimes he will die. Maybe 4% will die or less, who knows? Nobody knows for sure. But if we concentrate in a person who is immune, has high vitamin D levels, high vitamin C levels, and eats a lot of fruits and vegetables, the chances are that their immunity is good, and the chances of dying from coronavirus is very much less. So should we concentrate on face masks, face shields, washing the hands with soap and water, especially when it's no water, or alcohol? So this is the discussion we want to have with you, and you make up your minds which is more important. A person that washes their hands, wears a face mask, wears a face shield, but low immunity, versus a patient or person without face mask, face shield, but has high immunity. Who is going to die if they get coronavirus? So, vitamin C is one of the important factors in immunity. The other one is vitamin D. D3, 10,000 units a day may be best. Or sunlight is free. So if you have money and there's availability of vitamin D, buy it. Even if you get sunlight. No money, get sunlight. So, why is vitamin C important? Vitamin C has many functions in the body. The first function that vitamin C was accredited to curing was scurvy. Ships going from Europe to America and back, it took about 2 months at sea. So in 2 months, they did not have any fresh fruits or vegetables, and many sailors and passengers developed scurvy. I think it took over 50 years or 100 years before they started giving lime. It's kind of a lemon to the sailors and to the passengers, so they don't develop scurvy during the 2 months trip. So they call vitamin C anti-scorbutic factor, so that they did not develop scurvy. But the anti-scorbutic factor, you just need a little bit of vitamin C. So the government said, well, you can prevent scurvy with this amount, and that is the minimum daily requirement, which is very small. But there are other factors in vitamin C. Higher levels, they fight viruses, and they can fight cancer. The more immune, resilient you are, or the strength of your immune system, you can fight cancer. So, viral illness is also one of the things that can be affected by high vitamin C levels. So most people, I'm sure they don't eat 4 servings of fruits and vegetables a day, or 5. Maybe they eat 1 banana, which is not enough. So, I think with this plague that's affecting the country, we should ask the government to import vitamin C and vitamin D or produce it here in this country, the Philippines, so that the poor people can avail of it. When I call people who know about vitamin C and ask them if there are supplies in the pharmacies, they say yes, but very expensive. The people who are selling vitamin C are also making money with vitamin C and vitamin D, and nobody can blame them. When they make money from rice, or they make money from cigarettes or shabu, everybody wants to make money. But if the government will import or produce vitamin C in this country, we can give it to the people at low cost and stop the spread of COVID-19, because the people are immune and the body can kill the virus before it spreads in the body. So vitamin C, magnesium, vitamin D, vitamin A, melatonin, selenium, zinc are some of the few nutrients that can help stop the virus. But what are the other effects of vitamin C? It's well known vitamin C is an antioxidant. There are studies that show it's a pro-oxidant in some cases. But antioxidants are very important in the body. Protect the cell membranes and the mitochondria and everything from what they call free radicals. And it's well known now that vitamin C promotes immunity and it has antiviral properties. One of the functions of vitamin C is that it improves T cell function, and T cells are very important in the immune response. Another, people who get very sick and they have what they call ARDS, acute respiratory distress syndrome, and they end up in ventilators, they have what they call a cytokine storm. The cytokine storm is that the body is producing a lot of cytokines where it damages the lungs. Vitamin C protects against the cytokine storm so that people will not get very sick and die. And you don't have to put them on a ventilator, which fails to keep them alive most of the time. So, some studies show that when you give vitamin C when the people are on the ventilator, high doses of vitamin C, they can get them off the ventilator easier. And at this present time, we see that they say a certain number of people have COVID virus, a certain number of people are on ventilators. But in my way of thinking, if vitamin C protects those people or gets them off the ventilator, they should give vitamin C intravenously to those people on the ventilators to get them out of there. Not just count them as person on ventilator. And then when the person dies, death, 7,500. It makes no sense. They should be giving vitamin C, IV, vitamin D, IV, zinc, magnesium, even hydrochloroquine. Now, many people will say that the medical literature on hydrochloroquine says that hydrochloroquine does not work. They are correct. The randomized clinical trials on hydrochloroquine showed no improvement of mortality versus no hydrochloroquine. Why? They gave hydrochloroquine 100 or 1 gram and then 500 milligrams twice a day for 8 days. The toxic dose of hydrochloroquine is 4 grams or 2 grams, maybe 4 grams. And they give about 8 grams of hydrochloroquine, hydroxychloroquine. So hydroxychloroquine is toxic when the patient has low magnesium. And about 90 to 99% of the older folks have low magnesium. So they develop cardiac arrhythmias, low QT intervals. And then they blame the hydroxychloroquine. But the problem is that they had low magnesium and they gave them a toxic dose. So when the mortality on hydrochloroquine is the same as the mortality without it, they say it did not work. So that is the main problem with randomized clinical trials. They only have one parameter that they are following. But they have to have magnesium, and do not give hydroxychloroquine toxic doses and expect survival when you're giving toxic doses. But I digress. This has nothing to do with vitamin C, or maybe it has something to do. So when you give vitamin C, large doses, even 100 grams a day, IV, it's not toxic yet to the patient. It has been given in many other scenarios. Vitamin D, the active form, given saves patients. And hydrochloroquine, maybe just give 2 doses of 100 milligrams. Half-life is 41 days. So maybe patients will survive rather than giving toxic doses and say, yeah, it does not work. So in randomized clinical trials, to me, it's not the best way to find out what is a good treatment for something, because they can only give one. Best treatment is to give multiple things that improve the immune system and prevent deaths from these bad effects of coronavirus. And people forget also that the coronavirus has been going around the community for years, maybe 100 years, nobody knows. Studies show that about 30% of the colds that people get every year are coronaviruses. COVID-19 is SARS-2, is a, maybe we call it altered form of coronavirus, or a mutated form that maybe has higher mortality than the usual coronavirus. So the old coronavirus, if somebody had it for a few months ago, the immune system already can detect some of the viral particles. And can, if the T cells find that viral particle coming in again, they have a faster way of killing that virus. That is why, if you look at the statistics, about 95% have mild and asymptomatic. Most likely they already have T-cell immunity against the coronavirus. And those that have severe and critical, most likely they have no immunity because they have low vitamin D, low vitamin C, low vitamin A, low selenium, and low magnesium, and low zinc. So the treatment is there. Give all these supplements with vitamin C, and you'll have less deaths. And what will be the consequence of less deaths from coronavirus? Lift the lockdown. Sweden has not had a lockdown, and the coronavirus deaths are low. The Philippines had a low coronavirus deaths, and 4 months after the lockdown, it went up because the patients or the people were deprived of sunlight. After they were deprived of sunlight, the vitamin D level went down, and more of them are dying now due to lack of sunlight. So lockdown causes more deaths from coronavirus. Thank you, and if you enjoyed this video, press the like button below and ring some bells that you can find there. Thank you.